Hola, and welcome to Who Wants to Be a Culturally Competent Clinician? Remember, we care. No se preocupe. Introducing your host, Andre Borrego.
And now to introduce our guest, James. First, for our $1,000 question. Which of this means to show regard or consideration for others, not intruding upon or interfering with others' privacy? A. Humility. B. Respect. C. Knowledge. Or D. Cultural competence. The correct answer is B. Respect. And now next to our $10,000 question. A patient comes in for a new patient exam. They have not seen a dentist in over 10 years and appear nervous and embarrassed. Upon completion of their exam, they are diagnosed with several cavities and periodontal disease. Should you A. Lecture on the importance of visiting their dentist regularly? B. Scare them over the severity of their condition? C. Empathize with them on the discomfort of dentistry and reinforce them on their decision to visit a dentist? Or finally D. Make jokes about not understanding how people are so scared? The correct answer is C. Empathize with them on the discomfort of dentistry and reinforce them on their decision to visit a dentist. Continuing on to our $50,000 question. A Hispanic patient from a rural town near El Paso comes to the clinic with a severe abscess on their calf. The patient tells you they've had it for about a month and a half, and it has only gotten worse. You need to take their history of this patient, such as ask about any current illnesses, previous treatments, or medications. How can you show cultural awareness in this scenario? A. Directly ask about any prescription medications or previous diagnoses. B. Ask if they have or currently use any natural remedies or take advice from someone else. C. Ask if they have traveled anywhere outside of the country recently. Or D. Ask what kind of treatment and medications items they have purchased from CVS. The correct answer would be B. Ask if they have or currently use any natural remedies or take advice from someone else. Now this is the $100,000 question. A patient comes into your clinic, needs 4 cavities filled. This patient is unable to pay to have all cavities filled in one appointment. What 2 characteristics does this clinician need in order to adequately treat this patient?
You know, I'm not really sure on this one. I'm gonna have to ask the audience. You in the blue.
I think it's B.
It's absolutely D. No questions about it.
Unfortunately, James, that is the wrong answer. We'll be bringing on another contestant. Our next contestant is Carla. Continuing on from where James left off, we are now with a $250,000 question. Paying close attention to, being aware of the comfort and wishes of others, and very polite and courteous is defined as A. Sincere, B. Genuine, C. Attentive, or D. Hardworking. C. Attentive would be the correct answer. Now for our second to last question, the $500,000 question. What is the term used to describe a physician who makes the effort to understand his/her patients beyond the clinical walls so that they may advocate for their patients better? A. Proactive, B. Aggressive, C. Idle, or D. Reactive.
Oh no, I think I need to phone a friend. Hello?
Hello? I think it's A, proactive.
Sounds good. My answer is A.
Proactive is correct. And finally, our $1 million question. What would you do if a Spanish-speaking patient appears in your office, but you don't know how to speak Spanish? Attempt to speak to the best of your ability?
Hola, yo doctor. ¿Cómo está? Stomach pain?
B. Use physical gestures to communicate?
Hello?
Hola.
I'm doctor.
¿Qué?
You got stomach
Tengo
pain?
dolor, me para.
C. Ask to use their family members to translate?
Hi, how are you today?
No entiendo inglés, tengo mucho dolor, me para. Mi hermano
Can you
también. Dile
translate
que
for
es.
us, please?
Pero dile que tengo dolor.
Yeah, his back kind of hurts.
Or D. Call a translator?
Hello, I'm the doctor. How may I help you today?
Hola, ¿cómo está? Tengo mucho dolor en mi espalda.
Oh,
No
let me
entiendo
get a
inglés.
translator. 1 second.
¿Qué?
Hola, buenas tardes. Mi nombre es Fabiola. Voy a ser la intérprete el día de hoy.
In this scenario, the correct answer would be D, to call a translator.
And all these traits come together to make a culturally competent clinician. Thanks for watching. We care, no se preocupe.